Hi, good morning Edward. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 21st of August 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Edward Smith.
And what is your candidate number, please?
My candidate number is 2457312.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
All right. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Have you ever had to deal with a stressful situation at the workplace?
Yes. I have experienced many stressful situations at work, which is quite common for a registered nurse. I once attended to over 20 patients alone, since the other nurse reported being sick. Most of them were in critical condition, which added to the pressure. I had to prioritize work, attend to the patients depending on their condition's severity, and perform procedures based on urgency. I managed to handle all the patients, even though I was exhausted by the time I was done.
Can you seamlessly adapt to shift changes?
Having spent some time in the medical care industry, I understand the importance and prevalence of shift changes. Therefore, I am always prepared for anything that comes my way. Whenever the hospital or clinic changes my shift, I rearrange my day immediately and try to get as much rest as possible before my shift. I also work on my focus, so that I don't get carried away or fall asleep during the shift, which I believe has always helped me be at my best.
What is the hardest news to break in the workplace, and how do you normally handle it?
I believe that the most challenging news to break is the death of a patient to a loved one. Telling someone that their child, relative, spouse, or loved one couldn't make it takes a significant toll on me. Even after 5 years in this industry, I still shudder at the thought of breaking the news. However, I usually take the patient to a comfort room, where we can be alone, and start by apologizing before breaking the news to them. I always stay with them for some time, offering comfort before suggesting that they call a loved one to come and pick them up.
How do you maintain a perfect work-life balance?
Working in a hospital or clinic setting can be pretty challenging, and therefore, I usually take the work-life balance requirement seriously. I have mastered the art of separating my personal life from my work life through meditation, journaling, and improved focus. I usually engage in the things I love, such as painting, whenever I am out of work. I also hang out with friends occasionally and, whenever possible, travel up country to meet my parents.
How would you describe the recent patient that you interacted with?
The last patient I interacted with was exceptional and, quite honestly, inspired me. Even in his critical condition, he was optimistic and couldn't stop motivating me, despite being on his deathbed. He was pretty old, and therefore, had a lot to tell me whenever I came to attend to him. Even though his death saddened me, I was glad that he had lived a long, wealthy, and happy life, leaving behind a happy and well-knit family.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking roleplay. Don't worry if I stop you when the time is up.
Good morning. My name is Edward Smith. I'm one of the nurses working in this department. I can see you have brought your son to the department. May I know the reason, please?
Yes, nurse. My son has swallowed a button, and I am really worried about him. Please do something to help him.
Don't panic. Bringing him to the emergency department is the right thing. We will take care of him. Be relaxed.
All right.
I can understand your concern. First of all, can I have your son's age and name, for the documentation purpose, please?
His name is Sam, and he is 2 years old.
All right, for better conversation, how can I address you?
You can call me Mihiraa.
Well, Mihiraa, now, can you answer a couple of questions about Sam?
Yes, I can.
Okay, Mihiraa, tell me, after swallowing the button, did Sam show any physical effects?
Physical effects? Could you please explain to me what exactly you mean?
Yes, physical effects such as nausea, vomiting, fever, abdominal pain, or anything else?
No, nurse. Sam seems to be okay, he hasn't been sick, and doesn't feel hot. He also hasn't complained about a stomachache, and doesn't have any other symptoms.
Great to know that, Mihiraa. Can you please explain more details about Sam's ingestion?
Sure, he swallowed the button about an hour ago. I checked his throat, it did not stick in the throat. Also, no injury or bleeding is seen at the throat.
All right, how big is the button, and also, what material is it made of?
It is a metal button, about 1 centimeter wide.
Okay. By the way, have you tried any home remedies to get the button out?
No, nurse. Soon after the incident, I just brought him to the hospital, because I didn't know what else to do.
Okay. Has he consumed any food or drink since then?
No, he hasn't eaten or drunk anything since he swallowed the button. I thought it will further increase the complexity.
Thank you for your information, Mihiraa. I will explain the next steps in his treatment.
Okay.
Initially, we will check his vital signs to confirm his current status. Based on that, your child will be prioritized for the consultation. During that time, you can return to the waiting area.
Okay.
After the examination by the doctor, the decision on appropriate treatment will be initiated. Do you have any questions?
I understand the proceedings. But, I would like to know how long he will have to wait to see a doctor.
Your question is reasonable. Perhaps, I am sorry to provide a specific waiting time. Definitely, in the emergency department the waiting time depends on priority cases, and the availability of doctors.
I think my son should be seen now because the button might cause internal damage, bleeding, or something else really serious. I can understand your worries, however, I can assure you that your son is currently stable, and his breathing seems to be as normal. Which means, there is no airway problems. That indicates he is not critical. Moreover, we are here for help as well. So don't worry, be patient, he is all right.
But nurse, will it cause injury? Your thoughts are quite natural. Being a parent, you might be really worried about your son's condition, but from the medical point of view, as your son has not shown any physical symptoms, and there are no signs of distress. So there is nothing to worry about at the moment. That indicates the chances of internal bleeding, or risk of damage is considerably low.
Okay.
Moreover, the button has a smooth surface and will not make any injuries.
All right. And how we will take it out?
Your thoughts are considerable. Mostly, the button is likely to pass through the system naturally when he opens his bowels.
Oh, really? So that no damage will be caused inside the stomach?
In most of the case, no damage will be caused. Your son is safe.
I feel much relieved hearing that.
Yes. Now, is it okay to bring your child in, so as to take vital signs for a better understanding of his current situation?
Of course, I will call my son in, so that he can have his vital signs taken.
Thank you, Mihiraa. I will prepare for taking the vital signs. I hope your son will be all right.
Thank you. That is the end of your OET-speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.